Okay, I was unable to get the sound to work in my video, but I can voice over. So I'll just explain what I was doing. I was just introducing myself and my patient. So now, hi, my name's Kristen. I'll be your nurse today. I'm just going to be doing a physical assessment on you, just to make sure that everything is going okay throughout your body. So is that all right? Okay, first we'll have you sit down on this bed and we'll start by assessing your cranial nerves. First, we're going to assess your first cranial nerve, and this is your smell. So first I'm going to have you plug one nose and then sniff with the other nostril. Can you smell that? Okay, great. And we're going to do the same thing with the other nostril. And tell me if you can smell this. Okay, you can smell both those essential oils. Okay, I will close this and put this away, and then we are going to go ahead, or your second cranial nerve we would already have assessed through your patient history, so we'll just go ahead and move on into your third, your fourth, and your sixth cranial nerves. So with this, I'm just going to check your eye motion with my light, so I want you to raise your eyelids, and then I want you to follow my light with your eyes, up, down, diagonal, and then I'm going to check your accommodation to light. So I want you to cover one eye and we'll check and cover the other, and those both look really good. Awesome. Okay, so next we'll check your fifth and your seventh cranial nerve, and to do this I want you to puff your cheeks out. Good. I want you to open your mouth, close it, do a smile for me, and frown. And then I want you to raise your eyebrows and wrinkle your forehead. Okay, that looks good also. And then for the eighth cranial nerve, it's just assessing for hearing, so I just want to make sure you've been hearing everything that I've been saying today. Okay, great. So that cranial nerve is intact. Now we're going to assess the 9th cranial nerve, the 10th cranial nerve, and the 12th cranial nerve. And to do this, I want you to stick your tongue out, move it side to side, open your mouth, say ah. We're going to use my light here and check inside, check your membranes to make sure they are all good, pink, moist, and intact, and those look good. So the last cranial nerve is number 11. I'm going to put my hands on your shoulders. I want you to raise them up. Perfect. Okay, that looks good. So now we are going to test your motor movements in your hand. I want you to go thumb to finger with every finger on both hands. Make sure that you can do that and you can feel each finger doing that. Now I want you to point to your nose and away with both arms. And now the other arm. Okay, good. And now we are going to give you an item in your hand with your eyes closed. Make sure that you can feel what that item is. It's a fork. Okay, good job. And now I'm going to draw in your hand a letter, and I want you to tell me what it is. A. Good job. Okay. Now we are going to have you stand up, and we're going to assess your walking, balance, and gait. So I want you to walk to the other side of the room, heel to toe, and then on your way back, go on your tippy toes, walk back, and then your heels. Okay, good job. So now before you sit down, I want you to kind of bend over the bed here, and we're going to do a scoliosis screening. Just check your curvature of your spine. Okay, that looks good. You can go ahead and sit back down on the bed. Okay. And we're just going to check your skin throughout the assessment, make sure that it's all good. So just want to check your arms there, and then we're going to look at your hair. Make sure we can feel the texture, if there's anything abnormal, any lumps or anything on your head. Does that hurt? No. Okay. So now we are going to look inside of your ears and your nose and kind of do an assessment there. So now I'll look inside your ears with my flashlight. Those look good. That one looks good too. And then up in your nose, perfect. And the other one, we're also checking for a deviated septum here, and you don't have one, so that's good. Now I'm going to assess your throat, so I'm going to feel your lymph nodes on each side. Okay, that's good. And other side. All right, now we're going to check your pulses, so I'll just have my finger on each side of your neck. Check your pulses, make sure that those feel okay. Okay, now we're going to assess your back side, and then we'll move to your front side, and just kind of we're gonna assess for CVA tenderness here, do some percussions around your kidney area. Tell me if those hurt. Okay, no pain there. And now we're going to listen to your heart and your lungs. So take deep breaths. And we're going to listen for 30 seconds in each lobe. Okay, now I'm going to switch to the bell, and we're going to auscultate our 5 different heart sounds: aortic, pulmonic, the second pulmonic, tricuspid, and then mitral right there. Okay, those sound good. So now we're going to have you lay down, and we're going to look, listen, and feel your abdomen. So first we're looking, it's not rounded or anything, so that's good. And now we're going to listen. Listen to each of the 4 quadrants for 30 seconds each for some bowel sounds. And now we are going to feel your abdomen here. Make sure that there's no masses or anything, so we're going to start with a light percussion, or a light palpation, and then a deep palpation. So tell me if any of this hurts. Now we're going to go deeper. Tell me if any of this hurts. It feels okay? All right, good. Oh, now we're going to do some percussion to assess for any ascites. Any pain with that? No? Okay. Now we're going to look at your extremities. We're going to look at your arms and your legs, look at your skin and the overall color, feel your pulses, make sure they're even. We're going to do cap refill. Those are less than 3 seconds. And now squeeze my hand. Okay, perfect. And now raise your arms up against mine. Perfect. Now we're going to do the same thing with the legs. We're going to check for edema. I'm going to push my finger into your feet and see if there's any pitting. No, there's not. So now we're going to check some pulses and your cap refill and your strength of your legs. And that's all looking good. So your assessment was awesome. Everything was normal and fine. The last thing I would do is check your deep tendon reflexes with a hammer, which I do not have. So I would do that. But yeah, that's the end of your assessment. Thank you for letting me do that. Okay, bye.